For Action News, I'm Anna Dulosky. If you're seeing a lot of bearded men this time of year, there's a good reason for that. November is now more commonly known as Movember, a month dedicated to raising awareness of men's health issues. And one of the most important conversations we should be having this month and every month is the one about appropriate screening tests, what to test and when. There are certainly some cancer screenings that should be done routinely, and yet it's not often the case. More than 4,000 people die from cervical cancer each year, with 12,000 cases detected. The Pap test and HPV testing should be done every 3 years in women starting at the age of 21. But when it comes to screening for prostate cancer, it has been shown that screening men over 70 years of age simply should never be done. It results in overdiagnosis and overtreatment at an astounding 70%. Here's ACTIA's Director of Public Health, Ariel Sabransky, with more.
In the New York Times today, there was an op-ed that was discussing how the rates of thyroid cancer in South Korea have been increasing. But the real reason behind this increase isn't that there's some environmental factor or something else that's in play here. It's because South Korea implemented this screening protocol where people are being screened for thyroid cancer. Now, in the case of thyroid cancer, you're really not supposed to be screened at all unless, you feel a lump or, there's some sort of really strong family history, because most of the thyroid cancers that you find are very small. They're never going to actually manifest in dangerous ways in a person's life. So by screening for thyroid cancer, you just have these unnecessary diagnoses, and it just creates unnecessary stress, unnecessary procedures in these people's lives. So thyroid cancer screening is really something that you should not be doing routinely. In the case of cervical cancer, you really should be getting a Pap test, every 3 years if you're a certain age. And 11% of people in the U.S. have not received appropriate screening for cervical cancer. This is something that's really important to get done because 12,000 people every year are diagnosed with cervical cancer, and 4,000 to 5,000 people in the U.S. die of cervical cancer, and this is something that can possibly be prevented. Then there's also prostate cancer, which 75, 80-year-olds are going to their doctors and receiving prostate cancer screening, which is really not going to do anything. You're going to get some false positives. You're going to put these older people through these procedures that are just really going to be more detrimental to their health. So we should really listen to those protocols as well to, evaluate circumstances on an individual basis and not just routinely submit these 75, 80-year-olds to prostate cancer screening.
To read more on this story, you can head to our website, actia.org, and while you're there, don't forget to also sign up for your daily dose of news delivered straight to your inbox. For Action News, I'm Anna Dulosky.